Hi, I'm Peter Anderson. So I'm the unofficial ultrasound director at Eisenhower Medical Center Emergency Department. I want to go over some basics with setting up the ultrasound machine for central line placement. One of the first things I wanted to point out are some basic features of the machine, specifically the probe that we use for central line placement. There are two probes, as you can see, connected here and here. And in order to select the appropriate probe, you simply push the button above the connector where the probe connects. This is the central line. This is the high resolution probe that we would use for central line placement. And so when you turn on the machine, the first thing you want to do is push that button and make sure that it lights up, indicating that the probe is active. The other simple thing I'd want to point out with this machine is in the back of the machine there are several plugs, and there is one plug, if you notice, for the printer, and there is one plug that actually plugs into the machine. And so it's really important not to get these confused, because if you plug in the printer cord mistakenly, the machine will turn off in the middle of your procedure because the battery will run dead. So this is the machine plug is the one that comes from the bottom all the way up here, and so attached to this black cord. Okay, and in terms of positioning the machine, with relationship to the bed, you want the machine facing you as you stand at the head of the bed, facing the patient's feet. We're going to turn the machine on. Here's the power button right here. And then it's going to boot up. As we pointed out earlier, the lights will light up as far as which probe is active. And you can see that to activate a probe, you simply push the button, light comes on. In that case, that's the cardiac probe or the abdominal probe. And if we push this button here, it activates the high resolution probe that we use for central line placement. The other thing I want to point out is please try to keep the cords and the probes in their proper little whatever you want to call it, holder. A lot of times when I walk up to the machine, I find the probes laid over like this or like this. And these probes are very, very expensive and difficult to replace, and if they hit the ground, they basically are ruined. So really pay attention to the cords, make sure they're in the holder, and try to get rid of loose wire and get it out of the way. So once again, to activate the probe that we need is the high resolution probe. As you can see here, the abdominal probe light is on. We need this probe, so we're going to push this light. Light comes on. Probe boots up, activates the probe, and you'll know it's a high resolution probe because you'll see a perfectly flat line. Just pause a little bit. So as far as positioning the tray with relationships to the table, I like to have the ultrasound machine a little bit out of the way but perfectly visible from where you're going to be standing, and I have the Mayo stand within arm's reach. This is the kit that we're going to be using for ultrasound guided line placement. Most of the equipment, sterile equipment and caps, gowns, eye shields, and drapes are actually contained within the kit. So the only additional things you will need that I would recommend is an additional packet of sterile ultrasound gel, the actual ultrasound probe cover, and your sterile gloves. This kit that we currently have, actually these flushes that are in here, the package indicates the contents are sterile. So the entire syringe and the fluid within the syringe is sterile. So these actual flushes can be opened up on the sterile field for you to use and flush the lines. So before you even open up the kit, you can actually take these sterile flushes off and set them aside. Okay. And then we're going to open up the kit itself. Contents are sterile, so we'll leave that open for now. Anything you touch inside the kit is sterile, so you're going to need sterile gloves to touch anything in there. So go ahead and open up your sterile gloves. And we're also, at this point, we can open up the probe cover. This is the ultrasound probe cover, and put it into your sterile field. And your ultrasound gel, which is also sterile, and put that into your sterile field. Okay, now you're ready to start opening up the kit and setting everything up. So I'm going to place your sterile gloves on. Start opening up the kit. This is your sterile ChloraPrep, your eye shield, and your cap and gown. You're going to need somebody to put these on for you. When these are going to be, someone's going to need to put these on the physician. Okay, so we'll set those aside. Inside the kit, as you can see, there is a gown, a towel, and a drape. Okay, so what we're going to do is first we can gown up. And you can have an assistant basically take the card from you, and then you're going to roll around in a circle, and then pull the string, pull the card away from the string, and then you can tie it also without contaminating yourself. And at this point you can have someone place a cap and gown on you. Pause that. Now you're gowned and you're sterile and you're ready to basically do the procedure. You're going to have to drape the patient. So the way these drapes come, there is a fenestration here, and it is clearly labeled with the side that the head goes on. We're going to place this on after prepping the patient with a ChloraPrep. So let's imagine we're going to prep the patient, okay? So then we're going to prep the patient like that. And then we've got our drape here. I'm going to place this opening directly over the patient area that you prepped. Unfold the drape. Okay, and everything is labeled the direction you're supposed to pull the drape. So I pull it this way. This arrow says pull it that way. So everything pulls out, leaving you a sterile site through which to perform the procedure, which is still covered and protected. Now at this point, you're going to need an assistant in order to not contaminate the ultrasound machine. We need to get the probe, in order not to contaminate the ultrasound machine, we need to get the probe cover on now, which, if you recall, we opened up earlier. And inside, this is a part that confuses a lot of people. We open up the container, and everything comes. Everything in the container, you're basically are going to use, including these little rubber bands, which are easily lost. Well, take that back. I don't really use these things. We can chuck those. But in any case, we have some extra gel. We've got these two rubber bands. At this point, it's really this is the tricky part that a lot of people get confused on. You see this probe cover is all folded up here, and you got to turn it around and look at it, and you're going to find a little arrow. And what we're looking for is where the hand is. Okay, because that's where your hand's going to go. So if you see that, that is where your hand goes in to actually get the probe cover onto the probe. So we're going to stick our hand in there, and as you can see, it's pretty close to the end of the probe cover. And now we're just about ready to put this on the probe cover, on the probe. But before we do that, we need to actually get some gel on here. A lot of people will make the mistake of actually putting the probe cover on without the gel. And if you do that, you won't be able to see anything. So, you're going to need to open up your gel. Basically apply a good generous amount of gel into the end of the probe cover. Alright, have an assistant, you got it?
Yep.
And have an assistant hold the ultrasound probe upside down by a portion of the cable, leaving you some room to actually grab the probe with your hand that has the ultrasound probe cover. So you don't want your assistant to let go until you have a really good hold of that probe, because it's very slippery at this point. So once you have a good hold of it, you can say, okay, you can tell your assistant, let go. And then now you're going to turn the probe upside down, and now without touching the probe, you're going to slide the probe cover down over the probe. And now, as you can see, the gel is sitting on top of the probe. Okay? Now that gel will easily fall off and slide off if you don't use your little rubber bands that came in the kit. So you can take a little rubber band and put it over the end of the probe, and that'll keep most of that gel in place. You can use two if you like, or you can try to position them anywhere you like. But that's basically the idea. You got the gel on the end of the probe. You got the plastic nice, fairly smoothed out. The rubber bands are holding everything into place, and now you're ready to basically do your procedure. Now we have our probe ready, our sterile probe cover on the probe, and we're going to have someone turn on the machine for you if it's flicked off. Sometimes it does that to save battery. And now you can see that you've got your lines that you typically see in the with the high resolution probe. And now we have our extra gel pack that we had in this opened up initially. We're going to open that up. Now you're going to see what happens when we put the gel onto the probe. You can see the gel start to make a little change in the appearance of the screen. Okay. At this point, what I like to do, since with ultrasound line placement, you want to keep your left, whatever's left on the screen is actually the real left on the patient that you're working on. So what I'll do is I'll take the probe at this point and I'll turn it upside down, and I'll actually, while I'm looking at the screen, I will actually touch the probe and make sure that left is left. So right now you can see that the right side of the screen is moving and the left side of the probe is being touched. So what we're going to do is we're going to flip that probe around so that we need to have the left side of the probe being touched and the left side of the screen moving. Now we're ready to do the procedure. We're going to put the probe on our imaginary patient like this, and then we're going to go ahead and visualize and place our line. Okay, so that's it for ultrasound line setup. Most ultrasound courses that are online or that you take in a class don't really go over this setup, and I think it's frustrating for a lot of people. But hopefully this will help you guide you through setting up the ultrasound machine and the drapes and the equipment so that we can place ultrasound guided central lines in our patients.